But we begin this morning with news that one of Long Island's largest hospitals will be adding a new dedicated place to treat their patients. Take a look at these photos. They offer you a sneak peek of the new primary care center. It's about to officially open at the Nassau University Medical Center. It is designed to help financially needy families and their children to provide a place to receive medical care and treatment, and will also allow them to bypass the usually busy emergency room. And joining us now is the president and CEO of NuHealth and the Nassau University Medical Center. He is Dr. Victor Politi, and welcome to the show.
Thank you, Richard. Thank you very much for having us and giving us the opportunity to talk about the new primary care center.
Yeah, it's exciting to a lot of folks. Tell us about this new center.
Well, it's 38,000 square feet. Cost about $35 million to build on the first floor of the Nassau University Medicine campus on Hempstead Turnpike in East Meadow. State-of-the-art rooms. We have a beautiful pediatric department, beautiful OB/GYN, and internal medicine for primary care.
How long has it been under construction and renovation?
It's been about 2 years in the making, and we finally are going to open up October 4th.
Well, it has that brand new spanking look to it, doesn't it?
Yes, it does. And I tell you, they really went into some modern, minimalistic type of architecture. It really looks nice.
Well, the design is beautiful. You don't expect to always see that in a hospital setting. When will it officially open?
October 4th. There will be a ribbon cutting on October 4th. So we're looking forward to that.
Are there already some people using it?
Yes, we now are going through a little dry run, occupying the space with patients and seeing if we have any kinks that we have to work out of it.
So who's it targeted to or for? Who can use this place?
Oh, basically for all residents in Nassau County. It's a full primary care center. It's, for example, the internal medicine. We have both cardiology, pulmonology, endocrinology, gastroenterology, all the different subspecialties. It's designed to be like a doctor's office where you call up, you can make an appointment, come see your physician. He's your physician. He follows your care throughout the course of your life. He's your primary care doctor.
Have you already dedicated staff to it? How much staff will be there?
Absolutely. We have at the hospital about 400 physicians, of which about half of them will be operating through that primary care center, seeing their private patients.
Well, you mentioned a number of disciplines, medical disciplines. Is there anything specific or unusual or unique about this primary care center for a particular type of patient?
Well, it's basically there to fill a need or the gap in people's health care. So if you need a physician, you call up. We have a physician that's ready in that specialty that you might need for your particular case.
Now, my understanding was this was meant to try to veer people away from the emergency room because, well, what's the emergency room like now?
Right. Well, we have a level 1 trauma center in Nassau County. So NUMC is a place. I mean, it's the EMS works out of there. The Fire Police Academy is there. We have the 2 heliports. So this is a real trauma center. And the ER is pretty busy, about 75,000 adult visits. We also have a separate pediatric emergency department. And, if you're coming in for your diabetes, your hypertension, your asthma, your routine care, you shouldn't be going to the emergency department. You should be seeing a primary care physician, a pulmonologist, cardiologist, and that's what we're meant to do.
So this should take a little bit of burden off the emergency room as well, no?
Well, hopefully we'll keep people healthier. If we keep them healthier, then they won't need to come to the emergency department.
So you can make appointments to go there, or
yes.
Is it just a walk-in or both?
No, we have walk-in, but there's also appointments. So if you have a particular doctor, you want to see Dr. Politi, Dr. Politi has his office hours Monday, Wednesday, Friday. I follow you for your hypertension. You become one of my patients, and we follow a continuity of care type of model.
$35 million. I guess in the medical world, that's not a lot of money, but for most of us, that sounds like a pretty big price tag. How was it paid for?
It basically was used through VAP and HEAL grants from New York State. We applied for various types of grants, and we were able to achieve that goal.
For people who don't know, Nassau University Medical Center has an unusual relationship. Now, explain how it's, who backs it, what its relationship with the county is.
It was once a county hospital, but back in 1999, it became a public benefit corporation. It is a public hospital. It's the largest public hospital in Nassau County. We have about 4,000 employees. We see, somewhere in the neighborhood of 300,000 patients through our primary care center. And so it's a pretty big hospital. And, we're not just there for the community. We're there for the underserved. We're there for the patients that really need us. People think of Nassau County, they think of it as very rich and, type of affluent type of area, but there's a large swath of communities through Nassau County that really need services, and we're there to provide top quality care for all all people at all times.
And NuHealth is sort of like the umbrella corporation, is that
Right.
what that is?
NuHealth is the system. We have federally qualified health care centers throughout Nassau County. We have the large A. Holly Patterson 589-bed nursing home. The system itself is called NuHealth. The Nassau University Medical Center itself is that 19-story building, tallest building in Long Island.
You can't miss it when you go down Hempstead,
sure.
and you can see it in the distance.
Yep.
I always use it as a landmark to know where I am.
Sure. It's a great hospital. And I've been there now as a CEO for 2.5 years, and I can't tell you how proud. I mean, I'm a Belmore guy, a Long Island guy. Never had any idea what was going on over there at Nassau University Medical Center, but now that I'm there, it's really an amazing place. Amazing physicians, amazing staff.
Well, you went back to when going back to 1999 when its relationship changed. In past years, it went through some financial struggles. That was 15, 16 years ago. How are the books now?
We're doing okay. We're actually turning that place around. We are focusing on going after collections, bringing out more coders. It was financially strapped for a long time, and they didn't have the staff to actually go after some of the denials and some of the other issues. But now we're focusing on that, and we're actually receiving some money from the state as well.
On another topic, as you know, the hospital used to take care of the patients from the Nassau jail, the inmates there.
Right.
That got changed. There's another corporation that came in, and there's lawsuits and all kinds of investigations, people unhappy with the care. And some people saying maybe it should go back to Nassau University Medical Center. Is that possible at all?
Well, I mean, the arm of medical care, if you think of correctional medicine, that's a subspecialty of medicine, just like you have other specialties. And in correctional medicine, that's turned or evolved into a specialty. The Armor Medical at the Nassau County Jail has physicians that specialize in that type of medicine. They have all the services there that they provide for those special subset of patients. We were at one time taking care of those patients. We had a prison ward at the hospital, but I think it's more effective if you have that care being taken at the prison. We still receive those patients. Don't get me wrong. If someone is really sick there in an emergency situation, they call the ambulances, they bring them to us, and we do everything we can for them.
Because you're right next door pretty much.
Absolutely.
Well, Dr. Victor Politi, talking about the new Primary Medical Care Center that you're going to see opening in just days. You got a sneak peek of it here today. Thanks for the preview.
No, thank you very much for having me.